I got interrupted as I was finishing my treatment for right flex sacrum. So I was explaining that you would push anterior and superior right here. The right leg is loose by abducting it and slightly internally rotating it. And so I would be applying the pressure as the person inhales, holding it in position as they exhale until I reach the maximum range that I can push it. I would hold it for a cycle and release as they exhale. I forgot to mention also about in a flex sacrum you could also check for the lumbar spring test, and it'll be springy if there's a flex sacrum. So you would check the thoracics and compare kind of a CPR thing where you press down, and this should be more springy. That's just kind of a verification. And also wanted to make sure it's clear that no muscles are involved. There's no dysfunctional muscle. In a flex sacrum, and the treatment is a respiration manipulation. So next, I won't be using this model now. I'm going to talk about sacral torsions and axes. So anyways, the axis is determined by the side that it's not coming out, but the base of the sacrum as opposed to the apex. So if it's this way, the axis, it's going to be a left axis, and same thing if the base is that way, going diagonally this way, that would be a right axis. So the first thing I'll explain is on an anterior torsion, what happens is the axis is created. For instance, this is our right axis. We'll use this one. So a right on right, this is the left piriformis muscle, and this is the right multifidi muscle. So the muscle that creates the axis is piriformis on the left. So what it does, it pulls down, so it pulls inferior and anterior like that. So the axis is created, and the only way that the pelvis can move now is on this axis here that we created. And so what ends up happening is the multifidi on the right pulls up, and so you have torsion that's facing to the right on the right axis, and it's called a right on right. So to create the axis, I mentioned it's the left piriformis. It rotates like that, and the place where the place where the sacrum jams on the innominate is right there, because it's rotating, pulled up like that. So the only side that can rotate is this way. It can go this way and that way, and since it's facing left and the right multifidi is pulling up, since the right multifidi is pulling up, it pulls it to face the right. So that's called a right on right sacral torsion. And I think I mentioned in the other video, so what you would find in this case, you would assess the sacral sulcus. So you would find that the right side is posterior, so it would be like that because the left piriformis is pulling. Then you would go to the ILA, and you would find that the right side is shallow, again because it's pointing that way. And also the right side would be slightly inferior, but it would be these two landmarks that would be more significant in a right on right torsion. So similarly, I'm going to talk about a posterior torsion now, and this is the left axis because it's at the base here, it's the left axis. So to create the axis, two muscles are involved, not just one, and it is both the left piriformis and